Joining me now is Washington State Senator Maria Cantwell, a member of several committees, including Commerce, Energy, and Finance. Senator, good to see you. Thank you for being with us. We're now in this business of discussing what happens next, all right? Maybe the Republicans can repeal Obamacare. Doesn't seem it would be particularly popular to do that. There are definitely, as I outlined, some problems with Obamacare. You've got some solutions you're proposing.
Well, Ali, let me just say, first of all, thank you. One of the reasons why I said I would come on today, and I had no idea you were going to do that segment, is because you deal in the details of the policy that we need to get to as lawmakers and as people who do need to work together. So I thought that was a good synopsis of the challenge. So the issue is that the Republicans almost have a war on Medicaid. They want to cap it and lower and kick people off of Medicaid when we know it's worked. It's helped them get coverage. It's helped the economy in the states and cities they're in. And instead have ignored the issue, which you outlined, the 6 to 7% of the individual market, where in some places it's worked well and other places it hasn't. And what do we need to do to make improvements? So stop the war on Medicaid, stop this overall repeal, and let's work across the aisle to focus on the real challenges.
So ultimately, and I sort of remind people about this when I can, the success so far of Obamacare, if you want to underscore successes, has been the Medicaid expansion. It's sort of, people seem to be obsessed with the individual market. And I have to tell you, if I were one of those people who didn't earn enough to afford my premiums, didn't earn so little that I would get a subsidy for it, I'd be, in some of the parts of this country, I would be annoyed because my premium has gone up in multiples. How do we get to that?
Well, first of all, there's a whole bunch of things that are in the Affordable Care Act that you probably didn't have time in your short segment to talk about, that are delivery system reforms, that are improving health care, focusing on managed care, focusing on patient outcomes, that are going to help us lower cost. And anytime you can help lower cost, you're going to help drive down the cost of insurance. So that, we'll save that for another Ali Velshi segment, and you could talk about that.
I guess, but that's a good point you're getting at. We pay so much more per person for health care than all other developed countries and rich countries and things like that. I wonder, I've heard some Democrats talk about moving to a single-payer system, when in fact what we need to achieve is universal coverage of some sort. Single payer is just one piece of that. What should the Democrat strategy be to say, hey, the parts of Obamacare that worked, we should be doing more of, without triggering Republican ire because they've decided single payer is socialist medicine?
Well, first of all, I think everybody should have access to health care, and I do think it should be universal. So the issue is, what can we get done right now? And in your segment, you talked about some of that individual market. Is part of the Affordable Care Act, there is a plan that's working very well in New York right now called the Basic Plan or the Essential Plan. And so families there are buying insurance for about $500 of an annual premium. And basically what New York did is bundled up a population, so there's 650,000 people, and offered that. So I call it the Costco model, because when you buy in bulk, you should get a discount.
That's the point of universal coverage, right? You don't have a risk pool that's made up of only sick or only elderly people. You've got everybody in the risk pool.
Well, you're marrying up two ideas, that an individual should have as much clout as a company that has, 4,000 employees and gets a discount. You want the individual small business person or farmer, what have you, to be able to get a discount as well. So bundle them up into a larger population like they did in New York and successfully drive down the cost and spread that risk. And so there's, I think, 13 different providers that are offering into that New York market. But at $500 for an annual premium, there's a lot of takers. A lot of people want that. A lot of people will pay that because they know that that's going to get them successful coverage. So those are the ideas that I think that we need to be pursuing. And I hope that our colleagues will stop the war on Medicaid and start focusing on this.
But, Senator, there are conservative Republicans, including Rand Paul, who say Medicaid expansion, though you look at it as a remarkable success out of Obamacare, is yet another thing that the government is now stuck paying for, and it's going to increase over time with our aging population. So, in other words, not everybody's got the same goal in this conversation.
Well, listen, as you showed, the facts don't lie, and I am sure you could go to hospital in my state after hospital who will tell you that the expansion of Medicaid drove down price on individual rates. That is, the individual consumer who is not on Medicaid, because they know that that Medicaid population without some base level of coverage is going to show up at the emergency room and drive up everybody's costs. So the key idea here is if you think about healthcare, they're almost like late adopters in an information age. A lot because of privacy issues, what have you. But there are a lot of reforms in managed care, and I know that there are some of my colleagues on the other side of the aisle that also believe this, that will drive down costs overall. And those things in the Affordable Care Act should be pursued. And if we keep going in this direction, make sure that people are covered, change the system to make sure we're making improvements of managed care, we will keep on a trajectory of making sure that there are lower costs.
Right. We need to keep going down that way. Senator Maria Cantwell, good to talk to you. Thank you for being with us.
Thank you.